Welcome to our new presentation. Our selected topic for today is high blood pressure. In this video, we have answered the below questions. 1. What is high blood pressure? 2. What causes high blood pressure? 3. What are the symptoms of hypertension? Welcome once again to our nursing exercise channel. If this is your first time here, we have a YouTube channel that aims to enrich your knowledge about your health, fitness, medication, nutrition, diet, etc. And if it is your plan to update yourself about these important issues for all of the important tips, advice, discussion and presentation, make sure to subscribe to our channel and click on our notification bell icon. Let's start our presentation. What is high blood pressure? High blood pressure, or hypertension, occurs when your blood pressure increases to unhealthy levels. Hypertension is a common condition in which the force of your blood pushing against the walls of your blood vessels is consistently too high. It may eventually cause health problems, such as heart disease. What causes high blood pressure? There are several factors that may cause high blood pressure, but the exact cause is unknown. The following factors may increase one's risk for high blood pressure. 1. Overweight or obesity. Obesity has been linked to several heart conditions including coronary heart disease, heart failure and type 2 diabetes mellitus along with high blood pressure. 2. Lack of physical activity. Lack of physical activity also increases the risk of being overweight. People who are less active and less physically fit have a 30% to 50% greater frequency incidence of hypertension, high blood pressure, than their more active peers. 3. Older age. Blood pressure is the force of blood as it flows through the arteries. As you age, your arteries may narrow and become stiff. Narrow arteries lead to an increase in blood pressure. High blood pressure can damage the walls of the arteries and the heart itself. 4. Genetics. Genes likely play some role in high blood pressure, heart disease, and other related conditions. This may be from gene mutations or genetic abnormalities inherited from your parents. 5. Family history of high blood pressure. It is also likely that people with a family history of high blood pressure share common environments and other potential factors that increase their risk of hypertension. 6. Too much salt consumption. A diet that is too high in sodium and too low in potassium puts you at risk for high blood pressure. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. 7. Alcohol abuse or chronic use. Drinking too much alcohol can raise blood pressure to unhealthy levels. Having more than 3 drinks in one sitting temporarily increases your blood pressure. But repeated binge drinking can lead to long-term increases. 8. Use of illegal drugs. Most illegal drugs can have adverse cardiovascular effects ranging from abnormal heart rate to heart attacks. Illicit drugs including cocaine, marijuana, amphetamines, and ecstasy remain potential sources of acute or newly diagnosed hypertension. They have powerful vasoconstrictor clearly related to hypertensive crises, myocardial infarction, arrhythmias, sudden death, strokes, and seizures, although not a definite cause of chronic hypertension. 9. Smoking. The nicotine in cigarette smoke is a big part of the problem. Both smoking and exposure to second-hand smoke increase the risk for the buildup of atherosclerosis. It raises your blood pressure and heart rate, narrows your arteries and hardens their walls, and makes your blood more likely to clot. Every time you smoke, it also causes a temporary increase in blood pressure. 10. Stress. Stressful situations can cause your blood pressure to spike temporarily, but can stress also cause long-term high blood pressure? When you are stressed, your body produces stress hormones, adrenaline and cortisol, into the bloodstream. These hormones create a temporary spike in blood pressure, causing your heart to beat faster and blood vessels to narrow. 11. Sleep apnea or do not get much sleep. Sleep apnea, characterized by snoring and frequent pauses in breathing during sleep, is a relatively common condition, most notably in those who are overweight. Has shown to increase risk for high blood pressure. 12. African or Caribbean descent. African Americans are at increased risk for high blood pressure. 13. Chronic kidney disease. Hypertension is common in patients with chronic kidney disease, CKD. The prevalence ranges from 60% to 90% depending on the stage of CKD and its cause. CKD is associated with a host of complications including electrolyte imbalances, mineral and bone disorders, anemia, dyslipidemia, and hypertension. 14. Thyroid disorders. When the thyroid gland doesn't produce enough thyroid hormone, hyperthyroidism, or produces too much thyroid hormone, hyperthyroidism, high blood pressure can result. 15. Side effects of medications. Various prescription medications, such as pain relievers, birth control pills, antidepressants and drugs used after organ transplants, can cause or aggravate high blood pressure in some people. 16. Certain endocrine tumors. Some tumors are a relatively rare and amendable cause of hypertension, often associated with a higher cardiovascular morbidity and mortality, as compared with that of both general population and patients with essential hypertension. This worse prognosis is not entirely related to blood pressure increase, because the release of substances from the tumor can directly influence blood pressure behavior. What are the symptoms of hypertension? If your blood pressure is extremely high, there may be certain symptoms to look out for, including the followings. 1. Recurrent and severe headache. 2. Fatigue or confusion. 3. Dizziness. 4. Shortness of breath. 5. Nosebleeds. 6. Blurry vision or other vision disturbances. 7. Chest pain. 8. Irregular heartbeat. 9. Blood in the urine. 10. Pounding in your chest, neck, or ears. 11. Nausea, vomiting or loss of appetite. If you have any query, please comment in the comment box, and if you enjoy watching our videos, please subscribe our channel to receive notifications every time we upload a new video. Hit the bell icon twice. Thanks for watching.